Mr. Gan Thiam Po.
Deputy Speaker in Mandarin，我感谢卫生部进一步扩大我们诊所与家庭医生在全民保健所能发挥的角色。多年前，我一些国会同僚向政府提议，让居民也能去邻里诊所，而无需到综合诊所，同时享有综合诊所所提供的比较价格低廉的门诊服务。政府随后就推出了 Trust 计划，让居民们能以综合诊所的价格到自己的家庭医生门诊。这个计划自试行以来，颇让居民们欢迎。当时我也分享从居民得来的反馈，许多时候居民往往会觉得见自己的家庭医生会比较亲切、可靠、可以信赖。因此，看了他的病情也很快的康复。所以白皮书的建议是可取的，居民们无需到综合诊所排队门诊，也可以轻松的到自己邻里的家庭医生就治复诊，并共同防范长期病的以防恶化，同时能获得及早妥善医治。我在上一次的国会里提到，什么是上医之医，就是就防范未来之病的医疗乃是最好的医道。所以这个白皮书是上医之医，高瞻远瞩，放眼未来，能让新加坡人就地安老。我希望在这个计划下，居民们可以有更大的灵活性，更换诊所或者家庭医生。如果家庭医生是去了另外一间诊所或者离职。Deputy Speaker, I fully support the excellence proposals in the white paper of Healthier SG. This preventive care model is yet another step in our journey to help Singaporeans achieve and maintain their best health and live more good years. The proposals in this white paper will further strengthen the roles of GPs in the national healthcare framework. It is a superior strategy and deserves our full support. I have always believed that our family doctors play an essential role in this endeavor. Residents find it comfortable to have family doctors with whom they are familiar with to look after their health care issue. I believe it can be technically done to have all GPs to have online access to patients' records. However, we must recognize that there is a need to balance patients' confidentiality and operational efficiency. In addition, I would like to ask the Ministry, how would the balance be maintained between need and demand for certain medications? Some patients may ask for more than necessary, and generic medications are generally more economical. But patients be given the choice between new and generic medications. Patients may still find a burden regarding the choice of new medicines. I hope this plan can be expanded soon to allow residents to visit more than one GP at similarly subsidized rates for the management of diseases. Some GPs may be more experienced and skilled at managing certain diseases. This is because certain GPs may have individual competitive strengths or specialties. Thus, each patient may like to have a principal GP doctor in attendance and be assisted by such specialists upon referrals. Next, may I ask, what will happen to the doctors or clinic in the case of uncooperative patients with problems adhering to their health care plans? I'm concerned because the white paper has stated that this new model will be outcome-based. I hope the ministry will not penalize the doctors in charge, and these patients should be the ones responsible for their own health. Many GP clinics, especially those in mature estates, are already overwhelmed with patients. For some popular clinics, the wait for the face-to-face onboarding health consultation may take days to weeks. If the enrollment for particular clinics is always too many for the doctors to cope, how will this be resolved? Another concern is regarding the use of Health Hub to those preferred clinics and enroll in Healthier SG. Will assisted support on-site and various helplines be available at the clinic itself or at CCs? As many seniors are non-IT savvy, and some may be illiterate, they will not be able to use the apps after enrollment to monitor their health progress. They may require simple printed materials to do manual recording. This means that the GP will have to manually key in the progress reports into the available system to enable monitoring. This additional work for GPs if they have many of such senior patients. For this group of seniors, they won't know how to use apps like Healthy 365, ActiveXG, and 1PA to book and pay for activities. They may have to ask the doctors to teach them during their first consultations or even subsequent consultations. And this will take up the doctor's time, which could be better used in treating patients. Another concern is about patients who are not enrolled into Healthy SG at GP clinics. The clinic assistant will have to remember to charge correct prices for patients under Healthy SG and non-Healthy SG scheme. For the popular clinics, the clinic assistant may be overwhelmed, resulting in longer waits for all patients. For residents who do not have chronic diseases to follow at the GPs, the face-to-face consultation after enrollment via Health Hub will probably be the first and only visit to the GPs under Healthy SG. I doubt anyone with no signal will want to see a doctor regularly. If a healthy person sees the GP for their first health consultation under a Healthy SG or subsequent follow-up, will they be given an MC or memo to excuse them from their work? Will all employers recognize such excuse sheet the same as during COVID, when employers must recognize ART positive result as proof? For such residents, the doctor will advise them on appropriate preventive measures as part of the health plans, such as health screening and vaccinations. The doctor may also make referrals to community programs. I'd like to ask if it's necessary for doctors to do social prescription for such patients. Won't health coaches be more suitable? With that, I support. Thank you.